So it is very likely that patients with endometriosis take time in conceiving because it is a major cause for infertility. So the circle is that the treatment for endometriosis is pregnancy, but to get pregnant with endometriosis is a problem. So if
this is what a vicious circle, I must say. Welcome to Food Pharmacy podcast. Today with us we have Dr. Shailee Bhandari, MD Obstetric and Gynaecology. She has experience of 10 years in the field of gynecology and she's a laparoscopic surgeon as well. Today we're going to talk about endometriosis. This episode is all about women health and we have the expert with us.
So hi everyone, and thank you so much for the invite. And I'm here to share my views on endometriosis.
So we want to ask you, what is endometriosis, why does it happen, and which age group suffers from it the most?
Right, okay. So endometriosis is basically, it means endometrium. Endometrium is the lining that covers the uterus and that sheds during each period. So that endometrial lining growing anywhere else in the body except in the uterus, that is called endometriosis. Okay. So there are multiple areas in the body where endometriosis can occur. The most common of them being in the ovaries. So where the endometrial lining bleeds with every period you get and they increase in size and they form a blood-like cyst. So it's like routinely, or in layman language, it's called chocolate cyst because that is old collected blood in the ovaries. So it's called a chocolate cyst or an endometrioma. Your next question being
which age group suffers from it the most?
Yeah, so nowadays we are seeing it very commonly in really young girls and unmarried population as well. It ranges from, it's there from menarche to menopause. So it ranges from like teenage girls to even your perimenopausal age group. But yeah, it has become very rampant in the past few years.
So what's the ratio of people, women or girls are suffering from it?
Say if we get girls in the OPD, say 3 out of 10 girls that visit us are actually patients of endometriosis. Yes.
And they have come to you because they have had a symptom
during their period. Yes. So the symptoms are sometimes so vague and sometimes they don't even have symptoms, and that's why we sometimes call it the silent killer, because people don't really realize the symptoms. Because the most common symptom for endometriosis is pain during periods, and that is taken so much for granted.
It is misguided as a period pain.
Exactly. So that's something that has always been told that it's going to happen for a few days. And that's when people just take painkillers and just go ahead with it. So sometimes it's not even diagnosed properly.
So it's just those 5 days and then there are no symptoms for any other days.
There's a way to differentiate a normal period pain and an endometriosis pain as well. So for a normal period, it's generally congestive pain. So it generally subsides in the first or the second day. By the second day, it is generally gone.
Yeah.
For endometriosis, what happens is the blood is getting collected inside. So the pain generally increases on the third and fourth day.
Right.
So this is something that people obviously don't know.
Segment.
Yes.
Right.
So this is something that people are not aware of, that what kind of pain and when does the pain actually happen are two very important things.
Right.
So for unmarried females, the only symptom would be pain. But if somebody comes to us post-marriage, then there are other symptoms as well. That there's pain during having sex. Then there are also patients that come to us directly with infertility, like they're not able to conceive. And that's when we check and we find that there's endometriosis.
Endometriosis.
Yes.
Right. So endometriosis is a hormone-related issue?
Yes, basically it is excess of estrogen hormone and lack of progesterone in the body that generally leads to endometriosis.
Okay. So this is naturally, it is not because of any external factor?
Not much. It's actually an innate thing that there is hyperestrogenic levels in the body compared to your progesterone levels. That leads to endometriosis. There are a few theories behind why it occurs. The most common one being that we say, it's called retrograde menstruation. That is when you bleed during periods. There are some live cells that enter into the abdomen via the tube. So
Okay.
that is one theory that proves endometriosis. There are multiple other theories, but this is the one that is most accepted until now. But coming back to your question, it is hormonal, and it is because of excess of estrogen hormone in the body.
And what are the stages of endometriosis?
So stages are again divided into 4 categories. So stage 1 and 2 can only be diagnosed by laparoscopy, because they are microscopic and very small implants that are not caught on ultrasound. Because ultrasound, as you know, is just like a shadow of what's inside. You can't really see a 3D image of it. So grade 1 and 2 are only caught on laparoscopy, and grade 3 and 4 are when there are bigger implants that are seen in the ovaries, or it is seen in the rectum, or seen behind the uterus. So that's grade 3 and grade 4. Grade 4 is like the severest form of endometriosis, where both your ovaries are involved, both the ovaries are stuck behind the uterus. The pain is quite severe. So that's like, sometimes we directly catch patients in grade 4 endometriosis because
it's
the
a silent
symptoms are
killer.
symptoms are neglected, or the symptoms are very less, multiple things. But yeah, so they're generally, when we see them in OPD, they're 3 or 4, because 1 and 2 are incidental findings when you do a laparoscopy.
So patients who suffer from grade 4 endometriosis have major issues with infertility?
Yeah, unfortunately, yes. Infertility and endometriosis nowadays go really hand in hand. And when you don't find any reason for infertility on the whole, and you go for a laparoscopy, you generally find grade 1 or grade 2 at least.
Right.
So, endometriosis has a lot to do with infertility. The reason being, the eggs develop in the ovaries, and the ovaries are somewhat damaged with endometriosis.
So what is the solution to it?
Well, again, with infertility, the solution depends on what the patient wants. So, when a patient comes to us, is unmarried, is not planning a family, and is only come to us for pain, so the management is completely different. When a patient of childbearing age group comes to us and they actually want to conceive, the complete management changes. And if there's a person who's completed the family, is around 40s, and just again has come for pain, the management is completely different. So one, it depends on the patient's needs. There are medical managements available, and there are surgical techniques available to cure endometriosis. But cure being the wrong word, you can only control
for the treatment of it.
Yeah. So you can only control this disease, but it's going to stay there until menopause. Because until menopause, as we already talked, you're going to have estrogen hormone in your body.
Yeah.
So you can only suppress the disease or control it, but it's very difficult to find a cure.
But once a treatment is done, does it reoccur?
Well, yes. Unfortunately, the recurrence rate of endometriosis only on medical management is 67% in 2 years. So if you
that's
do
a
not,
really high number.
Yeah. So if you do not give analogs, or it's difficult for lay people to understand, but there are GnRH analogs and injections to keep it under control.
Okay.
If that is not given, or if the patient is not on proper long-term treatment, the recurrence rate is 67%. After a surgical removal of the chocolate cysts, or say clearing the endometriosis, and then once you give these analogs and keep the patient on medical management, the recurrence goes down to 17%.
Okay.
So yes, proper treatment, long-term treatment with this disease.
With the surgery as well can reduce the rate of recurrence.
To 17%. Unfortunately, we've not gone below that.
Yeah.
But 67 to 17
even
is
after
also.
surgery, the medication goes on for the time until the menopause is finished.
Yes.
Okay, so it is something that you have to be on medication for a long period.
Yes.
But a girl who comes which is aged 15, 16 with same disease has to be on a medication for the longest time in her life. That is very difficult. Also for the girl and the parent, right?
Yeah. So here I would want to say that yes, it is not the best disease to have,
Yeah.
but with newer technology and so many medicines available, it has become better than how it was in the past.
Okay.
So there were patients with undiagnosed endometriosis way like years back also, and nothing could be done about it. But now we do have drugs that really help, and with IVF and other fertility solutions that you have,
Yeah.
it has become like the disease, we are able to cope up with what the disease has to offer.
Yeah.
So that is there. Obviously it's not the best thing to have, but there is a solution for everything. So it has become easier. Also, we talked about the treatment. The best treatment for infertility and endometriosis is conceiving. Because what happens when you're pregnant is that your hormones are shut down for 9 months.
For 9 months, yes.
So sometimes endometriosis might just become dormant post-pregnancy. That can happen, but there's no way to predict that.
Yeah, and those case study won't be even there to, get that authentic result for us to know that this is for sure, this is not gonna happen.
Yeah, so no, and it will happen to who and who not, that's very difficult to.
As we discussed that there is no cure per se, but how can we give patient a hope saying that it's gonna get better and it's not gonna worsen for sure. The period pain is the worst thing.
Yeah.
But with medication it's gonna decrease it.
Yeah.
So how can we help them resolve?
Well, see, the first and the foremost would be like good counseling and letting them know that this is something that is going to stay and they need to learn to live with it. But of course, having said that, there are medicines that are used for this, like Dynogest and other progesterone pills that decrease the pain to say 95%. So the pain with medicines is like almost zero, like when you're taking those pills. Yeah, like almost negligible. But the only thing is they need to be taken regularly and they need to be taken for a long time. So the only thing that there's a problem here is that there is a problem with patient compliance, that people feel that they are better now and they stop taking the pills. So that is when actually the disease reoccurs. So that is something that people
shows
need to know.
Those major symptoms again.
Correct, yeah. So because they start feeling better because of the drug, but then they feel like they're cured because they don't have the deep understanding of the disease. That is what happens, and they stop the medicine. So when that happens, it actually causes more issues.
So this is similar to a thyroid disease, right?
Yeah.
There is a thyronome which is given to a patient. And if they feel better, they'll stop it. But then the next time they have to increase the dose and take.
Correct. So it's like diabetes is going to stay, BP is going to stay. So endometriosis is something like that it's going to be there with you for quite some time.
Does lifestyle affect endometriosis?
Well, not.
When we say eating junk food or, having a lot of alcohol in the diet or not maintaining a sleep schedule, multiple things.
Yeah, so stress basically. Stress does affect endometriosis, and it does affect your hormonal imbalance in general. So stress and needs to be avoided, and obviously eating healthy is important. As we talked about, it is estrogen dependent. So estrogen rich food could be avoided. So like say soy.
Tofu, soy.
Correct. So you would know that better. But so all the estrogen rich diet ideally should be avoided. And obviously for a female or for a woman in reproductive age group, your hormonal balance is like, it's actually a balance.
It's a tricky
it's a tricky
phase
thing
in our lives.
Yeah, exactly. So to maintain that, not per se for endometriosis, but to maintain your hormonal balance, it's very important to eat healthy, to sleep right, to all of that comes in play then. So obviously you don't have a lot of papers on that, but for any hormonal imbalance to happen or to get an answer to why me, there's always going to be some shift in your routine or some stress that is always there.
So this why me is a big question that women of all age and girls they ask themselves. If something wrong happening, even if there's one small wrong thing, we'll be like, why me?
Yeah, correct. So,
So lifestyle, if we improve a bit from what we have been doing, this can probably help at one point.
maybe that's what. Again, see, so who, like, endometriosis happens to those people with, obviously, there's an innate risk of getting endometriosis for those who are hyperestrogenic.
For somebody who had a lot of stress in their lives at one point, could be emotional stress, could be work stress, or could be a relationship stress.
Right.
So that extreme level of stress when that body takes, it's gonna affect some organ.
Yeah, somewhere. Yeah. So that
So-
primarily would not be the only reason, but yeah, it does affect the disease as well.
And also, if stress is not managed with the disease, it's gonna increase more and more, and probably from stage 3 it can give to stage 4. Is it?
No. So it's anyways a progressive disease. So not
Yeah, it's
stress or no
progressive.
stress, because if you don't do anything at stage 3, it is definitely going to go
Yeah,
to stage
true.
4. So you have to intervene with a medical or a surgical management, depending on again what the patient wants. But stage 1 will progress to stage 4 if not done anything.
If not done, yeah. And there is a myth that if a person has endometriosis, she cannot exercise. Is it true?
Oh, I've heard this a lot in my OPDs, but that's a myth, as you said. They are allowed to do their regular routine as much as they want, and there's no restriction to activity, exercise, anything for that matter, because the only thing it's going to affect is your fertility and nothing else. So looking at a person, you will never know that that person has endometriosis. So there are no restrictions otherwise, except the medical part of it. But
Right. So dancing, cycling, marathon,
anything you want.
Yeah, swimming,
Yeah.
everything
Is allowed.
a person can do.
Yeah.
Weightlifting.
Yeah.
Weightlifting also?
Yes, is allowed.
Okay. That's a good thing to know, that you shouldn't stop yourself if you have a disease. Rather feel better.
Yeah.
And one way to feel better is workout.
Yeah. Endorphins.
Endorphins.
You get your
Yeah.
endorphins. Yeah, but that is a
And
myth.
then eating good kind of food.
Yes.
Natural
Eating healthy.
food.
Yes.
Without sugar, of course.
Yes. Without sugar, less preservatives, less sugar, and obviously more organic food is advised.
Alright. There's another myth with the medication of endometriosis. Does it give weight gain or any other side effect very prominent?
No. So, Vizan, that is Dynogest, is the drug that we're talking about. It needs to be taken daily. Apart from, maintaining your timing related to the medicine, there are no much side effects. Or weight gain, no. A big no. It's progesterone hormone, so it does not cause weight gain. The weight gain generally that happens with hormonal medicines that everybody talks about is generally because of estrogen hormone and not progesterone. So Vizan does not cause weight gain.
Here it is moreover like the estrogen is coming down and progesterone is coming up.
Correct.
So it's not going to give
So
weight
it's not
loss.
going to cause
Weight gain.
Weight gain, no. And no other major side effects.
Anything else with skin, hair, nails?
No, nothing. Nothing. So all of that happens is because of your estrogen hormone and not progesterone. So when you give a low dose progesterone from outside, it's not going to mess up with your human body system as such. And it's a very well tolerated medicine. There are you get a lot of surveys that patients have taken it for 7 years continuously with no major side effects. So there are patients abroad, not in India, but there are patients abroad like in Japan, where there are studies where they've taken it for 7 to 8 straight years with no major symptoms.
Does endometriosis affect any other organ of the body beside ovary?
So as we talked, there are very rare areas where endometriosis can present. Like the rarest of them is nose and lungs. Okay, you can see endometriosis in these areas as well, but of course it's very rare. It can happen in your cesarean section scar, in your episiotomy, that is your vaginal delivery scar. So anywhere where there is another theory that is a direct implantation theory, that wherever the endometrial tissue gets direct contact with any other organ in the body or any other place, and it can, yes, and it can get its blood supply from there, because they are live cells at the end of the day, and they start multiplying there. So everywhere during a normal delivery, the episiotomy scar, or during a C-section, the CS scar, all these places do come in contact with the endometrium, and these are the rare places where you can find the disease. Yes.
So how rapid is the spread of
that? Again, varies from person to person, and it's very difficult to like go back and know how long has it been there.
Right.
But if caught early, say in grade 1 or 2, that is generally found incidentally, then it's easier to treat. But grade 3 and 4, it's a little tricky. Yeah.
Okay. And is endometriosis sometimes misthought as a cancer?
Yeah, that does happen because of multiple reasons. There's a test that you do in endometriosis that's called the CA-125. So that's a tumor marker that is generally elevated and is in thousands for a cancer. But in endometriosis, that CA-125 is somewhere in the hundreds. So it's more than 50 and more than 30 at least, and it's somewhere 200, 300, 400. But it generally doesn't go above 1000. Okay. So when it is above 1000, it is generally seen with malignancies. So there is a misnomer, or when people see a report of CA-125, they get scared that, oh, it's cancer. But endometriosis is completely different from cancer. Okay. It's just a common tumor marker that is used for both the diseases.
Right. All right. So it's not that if the marker says that it has this number, matlab you have endometriosis, you really need to go to your symptoms.
Yeah.
And consult an expert to know the depth of the disease.
Yes. So you need to know your symptoms. You need to, get an ultrasound, if necessary, an MRI, and then a laparoscopy. So everything together is going to give you the grading.
Right result.
Yeah, the grading of the disease. Yes.
Right. So Dr. Shailee, would you like to give our viewers who are also patient of endometriosis a hope via case study that it's gonna get better?
So we had an unmarried girl a few years back, and she was diagnosed with endometriosis. We kept her on medical management until she, planned to get married. And a very loyal patient used to come to show us, very regularly. And her disease was kept under control with medical management. Once she got married, we planned a laparoscopy surgery for her, got rid of all the cysts and all the adhesions. And then the patient went for IVF and conceived in the first cycle as well. And now that patient has a healthy, happy baby. So yes, with technology, things are getting better, and there is a treatment for everything.
That's really good to hear.
Yeah.
So that's an ultimate hope that is out there. And if you have this disease, you should not stop your life.
Yeah, of course.
You cannot stop your life. You definitely think about managing it and moving forward.
Correct.
So when you say that there is a medical management, and after that there is a laparoscopy.
Correct.
And then also you have to take medicine for the longer time. But meanwhile, when the medical management is there, but if we do a laparoscopy before.
Right.
And then we continue with the medical management, what happens?
So you should do it in cases where the endometriomas are very large, when the patient has a lot of symptoms, when the AMH is pretty down, that your ovaries are already compromised. Yes, you do go ahead with a laparoscopy surgery.
Right away.
Yes, right away.
When we know.
Yes. So you get rid of the adhesions, you remove the chocolate cysts. But then what you're removing is actually the macroscopic disease. There are microscopic implants that you can't really do much about. So post laparoscopy, you have to give them analogs, that are the injections we talked about, and then you're supposed to put them on medical management. That will keep the disease or the hormones under control, because what you're doing is surgically, anatomically correcting what has already been damaged. But for it to not happen in the future, you have to give them medical therapy afterwards. So that is an option.
So that is one part of it. And another is, okay, we take medical management and we'll wait until
Right.
the laparoscopy and that phase starts.
Correct.
But meanwhile, does the organ stay stable, or does the cyst stay stable, or what if it spreads in that time itself?
So if
What happens then?
Yeah, so that does happen, but very rarely, that people do not respond to the medical management. So that's when the patient is on medicines, it's not like we are not seeing them or they are not in regular follow-up. They always come back to us. We do get their CA125 and other tumor markers checked. We do a regular ultrasound. So if there's an increase in size, increase in the levels of the hormone in spite of the medicine, that's when probably surgical intervention is required.
So then, like a very repetitive monitoring of the patient happens.
Yes. Even when they are on medical management, say even for years, but they are supposed to visit their doctors every 3 monthly or 6 monthly, that is going to be there. And if it's staying stable during that time, then we do continue the same management. But if at all, if there's a time when the patient is not responding to medical management, you have to intervene surgically. Yes.
Right. So the surgery part, we have to be very precise when it should happen.
Correct.
That's the critical point.
Correct.
If it happens, like if we come to know, okay, there is endometriosis stage 3 or 4, and 4 is very like a higher level stage, but if it's stage 3 and we immediately do the surgery, then also there are
Chances
issues
that,
and chances that it might come back.
Yes. So that's when.
And if we not do it, and if we wait,
Yeah.
then there are so probably I think there is a scope of it to spread in other reproductive organs.
Yes.
Both.
Correct.
So
So it's a very thin balance,
very
and it's a
thin
very
line.
very important decision to do what and when.
Yeah, when.
So when,
Yes.
again, as we discussed, it depends on what the patient needs.
Yeah.
So
The
if the
age
patient,
and the
yes, marital
phase
status,
when
the phase, yes,
where the patient stands.
yes. So if the patient is planning pregnancy or is okay if she conceives, then you probably do go for a laparoscopic
Immediately
management.
we can.
Yes.
But if not, then we can wait for some
So
time.
then in the other case, we are just pulling on time for the patient to reach that time in her life when she actually
ready
wants
to conceive, and then 9 months of break
Correct.
can happen to the body.
Correct.
Right. And after the surgery, after the laparoscopy, the patient is ready to conceive. But then she doesn't conceive, then IVF is the only option.
Yes. So it is very likely that patients with endometriosis take time in conceiving because it is a major cause for infertility. So the circle is that the treatment for endometriosis is pregnancy, but to get pregnant with endometriosis is a problem. So
this is what a vicious circle, I must say.
Yeah, so that is the problem. But yes, IVF plays a major role with patients with endometriosis. And IVF is one thing where you're taking good eggs, taking them outside in the lab, fertilizing it, and then putting it in the endometrium. So endometriosis per se does not really hinder this process. And so IVF gives better results in patients with endometriosis. Having said that, it's not necessary that you will need IVF. If your endometriosis is well under control and it has been treated well surgically and that's human body, and that's you never know how it works.
And also for IVF, there are this concepts. Sometimes it works and sometimes it doesn't.
Yeah, of course. So with IVF also there's a success.
There's a chance to everything.
Yeah.
For all your disease and all your solution to the disease.
Yeah.
Both. So Dr. Shailee, what do you think of our store Food Farmacy?
Well, I visited it for the first time today, and it has some lovely healthy options. So as we already talked, eat healthy, live healthy. So I think a lot of new innovative ways to eat healthy. Yeah.
Thank you, Dr. Shailee, for coming to our podcast series. It was wonderful to have you. We have learned so much from you.
Well, thank you. It was wonderful being here, and I hope everyone's educated a little bit more about endometriosis.
Definitely.
And if there's anything else, you can always contact us.
Yeah, please drop in the comment section on this podcast.